Right, hello everyone. Carlos Vergara here, one of the social media ambassadors from ASPC 2025. I have the pleasure here of being with Dr. Khurram Nasir from Houston Methodist and the new editor-in-chief of the American Journal of Preventive Cardiology. Thank you, Dr. Nasir, to be here sharing with us his experience, and very nice to see you.
Thanks for having me, and such a wonderful meeting. And I think so. This whole American Journal of Preventive Cardiology is such an amazing opportunity for the prevention community in journal, because hardly there is any journal that is so tied with a focused mission. And for us, really, how can we disseminate and get the right message out, but also the right content, and how can we be a voice for prevention? So I'm very excited, and of course it's younger generation like you and many others who will take it to the next step. So I'm very excited and hoping that you and all of others will join us in this mission.
Well, certainly your energy is very contagious, and for us is like, inspiring. And let's start initially with, what are your thoughts of this meeting? What is the most significant thing that you're taking out of ASPC 2025 so far?
For me, ASPC, looking back almost 5 to 10 years, a small society thinking mostly around prevention. And then again, what we have seen is an exponential growth in what cardiovascular prevention means. Specifically, initially it started from lipidology. We had fewer tools, fewer mechanisms. Now, as you look at the interventions have expanded significantly. The cardiometabolic field is becoming, I would say, the foundational part of prevention. The tools that we have and how we assess risk, the foundational element of cardiovascular disease and prevention is, what is your risk? You heard this morning about polygenetic risk scores, imaging, and the interaction of that. And then implementation, which is huge. How do we take the best knowledge? We keep on thinking about discovering, but what do we do with what we know to make it usable, scalable, change the guidelines, implement it to the real stakeholders? And also prevention is becoming a big piece from our most important stakeholder, which is the patient and the community and the population. And what I'm seeing is that ASPC is also becoming I would say, a major platform where their voices are heard, and you'll see a lot of interaction and input from them. So from that perspective, I couldn't think of any other society that brings in so many players and stakeholders all together under one roof. And I'm hoping that many of you who are watching would join us next year in Scottsdale in, I think so, the conference is somewhere around the first week of August.
Thank you so much. And again, there is so much that we learn in your session, for instance, of the different phenotypes of preventive cardiology, and the all learning and learning again, because the paradigm, you don't only have to adapt, but shift the paradigm too. So what can you tell us about your why? Because you put this there in your conference. It was so powerful for research, right?
Yeah. So, the why was, I would say, the easier piece. And after graduating from med school, I came to US, and my first exposure was at a school of public health, Johns Hopkins School of Public Health. And clearly the why was easily, it makes economic sense. Number one killer disease, we have done amazing in discovering the processes, interventions, and protocols in how, once you have heart disease, from dying from it. But paradoxically, if you look over the last 20 years, the rates of the first presentation of heart disease have remained the same. More than 800,000 individuals still present with their heart disease. And by the way, that is their first time that they know they have heart disease. And now we're seeing, with the surgence of poor diet, lifestyle changes, the society where it's moving with less sleep, less ability to exercise, we're seeing actually heart attacks happening much in the young. So from me, and also coming from South Asia, where we're seeing heart attacks happening in the 30s and 40s, my thing was, why are we not focusing on taking all the data, tools, and interventions, moving them upstream? So that was an easy why, and that's also the why this society exists, ASPC, which is how can we bring all the right stakeholders on board to make sure that we achieve the same gains that we have in preventing people from heart disease to actually preventing cardiovascular disease.
That's wonderful. And one of the concepts that we have chatted in this conference about is how you were one of the pioneers and the strongest advocates of the power of zero, and that the way that name came to the power of zero. But there is another concept that I learned from you this conference, and that's the power of collaboration. So, for us as up and coming, we know that we can't do this alone. And you certainly have shown in your story that alone you can go until a certain way, but talk about the power of collaboration to everybody that is seeing.
I grew up in Africa, and there is a proverb: if you want to go quick, go alone. If you want to go far, be with a group. Now, initially, when we came up with this idea, a radical idea at that time, where the focus, rightly so, let's find people who are at risk, and we said, why don't we turn the idea upside down and say, what about people who are not at risk despite multiple risk factors, bad cholesterol? Can we be more flexible? And the first thing was a huge opposition. And as an early stage career, where you're picking up a radical idea and you're already facing an opposition, how do you move the agenda? The agenda really happened with, I would say, my peers, Dr. Shapiro, Dr. Ron Blankstein, Dr. Morris Franek. We were all fellows together sitting in the same room. And all of us came together. And then a very prominent resident across in Hopkins, Roger, who is Dr. Blumenthal, is like the father of preventive cardiology and connecting people. We all came together and said, let's solve this problem together in a respectful, scientific manner, and let's get the data that needs to happen. So in a period of 5 years, this group all coming together, and Seth Martin joining, and John McCoy, who's leading the prevention program in Ireland, and Miguel Canzos now, who is the leading preventive cardiologist in Spain, and Maros Bittencourt, who's now building a whole CT program at Pittsburgh, and many others came together and found those answers, which were multiple, and eventually took the point forward and enough data that our community, enterprise, and the guidelines could not ignore. So for me, the lesson was, if you truly are mission driven and you want to achieve bigger goals, you cannot do it alone. And the message for, I would say, the fellows and the young investigator is build a big network of people who share your weight, but also are able to identify your blind spots so that your output is much bigger than the sum of it.
That's again very inspiring, and I think that if you shine alone, like where's the value? Whereas if you grow with others and shine with others, then there's real light to the world for this, and we're just showing how that is the reality. I wanna kind of finish with a question where, now you as an editor-in-chief of the American Journal of Preventive Cardiology, what are your ideas of how to spread better the information, not only within the cardiology community, but also new generations and patients even? Is there anything that you can share with us?
So clearly, as Dr. Mikos and Dr. Nathan Wong, and so much gratitude to them on getting this journal in 5 years to the point. It's among the top journals. It's the impact factor is 5.9. And what an amazing opportunity for all of us to build on their foundation. Now, from my perspective, the journals most of the time are there as a reflection of what is happening in the field. For example, in preventive cardiology, and I'm saying we can become one that's not only a reflection of that, but shaping it. And the key things that what the journal exists and how do we want to do is, broadly, from a 44,000 feet view, are the three main-ish items. Number one, highest quality. We want to be a place where the highest quality, the most robust science is published. But at the same time, we're thinking on two additional things: service and outreach. And service means we are thinking from a perspective on an author and an associate editor or a reviewer, and how can we make it more seamless, frictionless? I can energize and bring all of those people. So Hopefully, we'll have no formatting. You can submit whatever. We'll have certain timelines, desk decision in 2 to 3 days, the final decision within 60 days. Once your paper gets published, publishing alone is not enough. And that's the thing, how do we get it to dissemination? Because even as an author, you want your work to be discussed. And as an editor and reviewer, you want to have your insights beyond the decision. And the general population wants it in a way it is more understandable. So we are going to bringing in big time our ability to disseminate after the publication. That will include podcasts by our deputy editors. We'll have interviews not only of the authors and AEs, but also of the reviewers. And I've been speaking with Carlos to help us decide our social media strategy that can go from all the way from tutorials, infographics, but also lay summaries that can reach out to the right constituency, because it's not only about the medical enterprise, but the community. And clearly we have to build bridges with the mainstream media and how we can bring them on board, them to understand it, because there is clearly a need and a demand by the general public that they want to have the most, I would say, valid voice or the middle ground voice in the noise of what you see around everything else.
Well, thank you so much for your time, and certainly we're very eager and inspired to try to continue to help grow this community, but it's just naturally happening with, you know, the energy not only from the mid-careers and leaders and you know, further careers like Dr. Blumenthal and you, but the early careers that come not only from fellows, but residents, medical students are also very eager to add to this community. And we're looking forward to all the work we can do together with the journal and beyond, with the society, and you know, for our patients. So thank you for your time.
Thank you so much. Thank you.